Think pelvic floor health is just about women and childbirth? Think again. Your pelvic floor affects the way you pee, how you poop, and how you move. And yes, even how you perform in bed. And it matters if you are 25, you are 55, you are male, you are female, or you are anywhere in between. Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Nderitu, a family physician. I have interest in public health and cancer prevention and treatment. In this video, we are going to look at the pelvic floor and why it matters for everyone. It is not just a women issue. For too long, the pelvic floor exercise and health has been treated like it's a women issue. Whispered about after pregnancy and also in menopause. But here is the truth. 25 to 50% of women and up to 16% of the men experience pelvic floor dysfunction in their lifetime. That is, the muscles that make up the pelvic floor do not perform optimally. Meet Silas, a 35-year-old man who has been thought to be having his bladder leaking. It is not just the age, it is his capacity to control his urine because of the effect of his pelvic muscles. So what is the pelvic floor? This is a hammock-like network of muscles and ligament which support your bladder, your bowel, and also the uterus in women, and also the prostate in men. So they work with your diaphragm. The diaphragm is the muscle that separates the chest from the abdomen. These are the core muscles for posture, breathing, and even circulation. So it is important that these muscles, they are the unsung heroes of our body's foundation, and we need to keep them strong. Why does your pelvic floor matter? Either you're a woman or a man. Women after childbirth or in menopause, the process of aging weakens your muscles. And this process of weakening of our muscles starts from the age of 30. And so this weakening of muscles, when it affects your pelvic floor muscles, can lead to prolapse of the uterus, can lead to urinary incontinence, and poor capacity to control your urine. And this can also lead to pain during sexual intercourse. In men, it can bring issues of erectile dysfunction, because for you to be able to control a good erection, then you need the strength of your pelvic muscles. And this can also lead to poor ejaculation, leading to urinary leakage and also pelvic pain. So if your core of your body hygiene is not working appropriately, the pelvic floor is the oil that keeps it running smoothly. So what are some of the common problems that affect your pelvic floor? One, weakness, leading to leak of urine, can lead to fecal incontinence, and also can lead to organ prolapse, which can affect the rectum, the uterus, and even the bladder, and especially in ladies. Then over-tightness, which is called hypertonicity. This can lead to pelvic pain, can lead to constipation because of the tightness, can also lead to painful sex, and also difficult emptying your bladder. So some of the misconception that we have is not just the weakness, but the muscles can be too tight, and this can also lead to problems. So what is the effect of these pelvic floor muscles on the quality of your life? Beyond the physical, Pelvic floor in dysfunction impact your confidence, your intimacy, and also your emotional well-being. Of course, if you're having problems controlling your urine, controlling your stool, this can lead to emotional discomfort and also fear of getting into social connections. So studies show that people with poor pelvic floor disorders have higher rates of anxiety and also depression. It is not just about the muscles, it is also about the quality of your life. So because of the stigma and embarrassment, people will not speak about it. And so diagnosis is delayed. Physical therapy is delayed, which is highly effective. And this can lead to problems. So ignoring pelvic floor is like ignoring a crack in your house. Small at first, but then can have devastating consequences later. So what are some of the things that you can be able to do to strengthen your pelvic floor muscles? One, the first thing is awareness. Knowing that if you notice any leaks in your urine or stool, then or pain or changes, this is not normal. This is not something that you should keep to yourself. Then you need to go for help. Then Kegel exercises. This should be practiced by both men and women, and learn to do them correctly, and you can learn to do them to strengthen your pelvic floor. Then balance. If pain and tightness are an issue, then focus on relaxation and also pelvic muscle stretches, not just the squeezing. Avoid straining, especially in chronic constipation, and also heavy lifting without using the right technique, because this can weaken your pelvic floor muscles. Maintain a healthy weight so that you don't put so much pressure on your pelvic floor, and also exercises which strengthens your pelvic floor muscles. Then seek help so that you can learn the right way to do the pelvic floor exercises. So guided training with biofeedback is often effective in strengthening your pelvic floor muscles. If this video has opened your eyes, hit the like button, subscribe, and also share it with someone who thinks pelvic floor health is only for women. And if you want to get guided reset for your pelvic health, then join the Health Insight 360 program for personalized coaching to increase your strength, your balance, and also confidence inside out. Your pelvic floor health is not just a women issue. It is a human issue. And caring for it, you are not just improving your body, you are also improving your life. Thank you for watching. We meet in the next video.